In the previous modules, we have seen that attentional impairments and executive impairments are an important part of the ADHD phenotype. We have also seen that some approaches, psychotherapeutic approaches, can be used to improve attentional processes, such as mindfulness. In this video, the question that we are going to ask is it possible to increase attentional and executive function through training? And we are going to discuss the usefulness of cognitive remediation. It should be noted that cognitive remediation is not part of the official guidelines in terms of treatment of ADHD. It is because the quality of the evidence is still low in this domain, but the quantity of evidence is increasing very rapidly, so it's possible that the guidelines are going to change in the next years. What has been most tested in the literature is the use of cognitive training programs. These programs are composed of dedicated games that focus on specific cognitive components, such as attentional skills or working memory. It should be noted that most of these programs, even some of them who are commercially available, have not been tested empirically. But there are some programs that have received some scientific evidence. One of the programs that have received some evidence in the literature is the training program Activate. It's a computerized program that has been designed to focus on 6 different skills through dedicated games. The target population is children with ADHD, and it has been designed to be used 3 to 4 times a week and to be adapted based on the individual level of the child. So there is really a need to assess the child before the beginning of the program to adapt the level of the difficulties of the game. Then the level of the difficulty progressively increases throughout the program, and it's possible to monitor the performance of the child gradually during the program. It is also a program that is thought to be combined with physical activity. So one can wonder if the use of such program is effective to improve ADHD symptoms in daily life. So actually, the current evidence suggests that those programs can improve specific functions that are specifically trained in these programs. So for example, if one of the programs focused on working memory, then the assessment on working memory test can improve after such a program. However, the transfer effect to ADHD symptoms or to functioning in daily life remains relatively modest. As an example, there is a recent review by Lambez and collaborators that has tested the effectiveness of 4 different types of intervention: cognitive remediation, physical activity, cognitive behavioral therapy, and also neurofeedback on specific cognitive function, such as executive functioning, inhibition, flexibility, attentional function, and working memory. And this review suggests that all of these interventions have some significant effect, but cognitive remediation has relatively small effects. And it tends to have effects on some cognitive function, but not all of them. Specifically, it has been shown that it was efficient to improve flexibility and inhibition, but less so in terms of attentional functioning and working memory. If we summarize the evidence today, we can see that those cognitive training programs are relatively efficient to improve specific cognitive abilities, but they have few transfer effects in terms of reducing the severity of symptoms or improving the functioning in the daily life. So there are 3 ways to potentially improve the effectiveness of cognitive intervention or cognitive remediation programs in future studies. The first way to potentially improve the effect is to combine cognitive remediation with other types of intervention. If we take the example of the Activate program, one study has shown that the effectiveness of this program alone was relatively limited. However, another study has used the Activate program in combination with other types of intervention, especially physical activity and also group sessions that are focusing also on the same skills with a lot of positive reinforcement by the trainers. And this study has shown that the combination combination of all these approaches was efficient to reduce ADHD symptoms and to improve some of the cognitive functions. A second way to potentially improve the effectiveness of this program is to change a little bit the focus of these programs, because some of the authors have shown that most of the cognitive intervention programs focus on specific aspects of the cognitive functioning that are not necessarily the most relevant aspects. If you remember, we have talked in a previous video about the Baddeley model of working memory and the fact that there are different components of this working memory, the storage component and the central executive components. And some authors have claimed that most of the programs have focused on the storage component, which are often not impaired in the context of ADHD. And they suggest that if we develop programs that specifically target the central executive component of working memory, then the effectiveness of this program would improve. And some of the studies, although quite preliminary, suggest that it is indeed the case. So a third and final way to potentially improve the effectiveness of cognitive remediation programs is to combine it with other interventions that more target the use of compensatory strategies. So as an illustration, I will just give two examples. In a study that was targeting children with ADHD, the goal was to improve self-monitoring to improve distractibility in the classroom. So in this study, they gave a small device to children with ADHD in the classroom that was vibrating every 5 minutes. And every time the device was vibrating, the child had to self-assess his performance in terms of distractibility. Was he off or in the task that was currently being done? And what was interesting in this study is that the use of this device was associated with a positive increase in terms of attentional abilities in the classroom, even when the device had been removed from the classroom. So it means that teaching these skills, this self-monitoring skill, was associated with positive outcome. Another set of intervention that can teach also compensatory strategies is goal management training. In this intervention, people are taught to decompose their activity towards a goal in a series of steps, and they are learning to use those steps regularly in the context of their daily life. So for example, when they want to achieve an activity towards a certain goal, they are asked themselves to reflect first on the task and to monitor during the task that they are doing it efficiently, and after the task to review if they have performed the series of steps efficiently. So those type of approaches have been also associated with an increase in terms of ADHD symptoms, or improvement in terms of ADHD symptoms over the course of several months. So to conclude, in this video, we have reviewed the current evidence regarding cognitive remediation in the context of ADHD. And we have also discussed about the efficiency and the effectiveness of these programs to reduce ADHD symptoms and improve the daily life of the patients with ADHD. We have also suggested several approaches to increase the effectiveness of such program in the future.